Hello friends, my name is Dr. Kunal Nath and I am a consultant neurologist and a medical advisor to medico-legal cases. These days a case of Honorable Kerala High Court wherein a anesthetist is being charged with criminal medical negligence for not getting a PAC done before the surgery of tubal ligation is being discussed. The crux point in that case is that the patient delivered on 11th of September 2014 delivery. We do not know whether it was a vaginal delivery or a LSCS. At least I couldn't get it in facts. And the tubal ligation was done on 13th. So the discussion which is going on in the medical groups is that if a PAC was done, suppose it was a LSCS, so PAC must have been done for the LSCS on 11th. So whether the PAC should have been repeated for tubal ligation when it is done just a day later, or it could have the earlier PAC would have sufficed for this surgery as well. So in this there are two body of thoughts. I discussed this case with a lot of surgical consultants and anesthetists, wherein one body of doctors said that if a PAC for a surgery is done on day 1 and a surgery is done on the same day, and if the next surgery is planned in the next day or a day after, and if the next surgery also has the same ASA risk, and in the intervening period there has been no new clinical developments, then we may not go for another PAC because it is not needed. But then there was another body of doctors who said that no, even if the surgery is done on the next day and there has been no intervening new development, still we get a PAC for every procedure. So I would just like to clarify the court's order regarding this case, because there are some misconceptions floating. In this case, the alleged doctor, the anesthetist who has been charged with criminal negligence, he has claimed that he got the PAC done. So he didn't say that I did not get the PAC done. So the question of, there is not a question of law in this case that whether a PAC should be done for every procedure or not. Actually the question is of fact. That is what the Honorable Kerala High Court said, that if the PAC was done, then whether the documents of that PAC were shown to the medical board which examined this case and allegedly found the doctor guilty of medical negligence. Maybe there may be a case where a file where the PAC document was there was not presented to the medical board, and the Kerala High Court said that okay, now that it is a matter of fact that whether the document was shown or not. So usually the Honorable High Courts deal with matters of law. So they said that now it is a matter of fact. So we will refer the case back to the trial court to first determine whether the alleged doctor who claims to have done the PAC actually got the PAC done by showing his documents. And even the medical board of 5 doctors who found that anesthetic negligent, they are also made witnesses, and they would also have to tell on what grounds did they find this doctor negligent. So in this case, why am I making this video is because this is a case of criminal negligence. This is not a civil or consumer court negligence. In a criminal negligence, in a criminal jurisprudence, there should be proof beyond reasonable doubt. So if there are two bodies of doctors, one body says that if a PAC has been done for a procedure and a almost similar procedure has been to be performed the next or a day after, we do not need to get a repeat PAC done. Whereas another body of doctors says no, we get a repeat PAC every time, immaterial of how minor or major the procedure is. So if there are two ways a doctor can take and he has chosen one way over the other, so according to the Boehm's test which we apply for medical negligence and which is applied in Indian courts also, so if a doctor has taken one course which a reasonable body of doctor would have taken, then this does not amount to negligence, and at least it does not amount to criminal negligence according to my little interpretation of law. Because if the doctor would have done a thing which no reasonable doctor in their right minds of reasonable competence would have done, then, and that would have been done with so carelessness and recklessness, only and only then it amounts to criminal negligence. If a doctor has taken a stand which some of the body of doctors would have taken, then according to my interpretation, it at least is not a criminal negligence. It may not also be a consumer court or a civil negligence. So, but in this case, the Honorable Court has said that now it is not a matter of law. They have said that okay, if a reasonable PAC would have been done, maybe cardiomyopathy could have been diagnosed and patient's right could have been saved. So ideally it should have been done, and what my personal opinion is that PSC should be done irrespective of when the earlier PSC was done. It should be repeated, because now the patient's rights reign supreme, and doctors should obey, honor the patient's rights to health, and do get the proper documentation done. But this case, more from a law point of view, it is a problem of preservation of documentation. So as the alleged doctor says that I got the PSC done but couldn't produce the document. So the dictum to save yourself from medical negligence: communication, documentation of communication, communication of documentation, and preservation of documentation. So in this case, I think there is a problem in preservation of documentation, or at least there has been some miscommunication with the medical board. The file which contained that PSC document has probably not been supplied to the medical board, because of which they came to the conclusion, and the debate now has been diverted to the fact that whether PSC has to be done for every minor major procedure, even if the previous PSC was done a day or before. So it is a case of, according to my interpretation, loss of documentation rather than anything else, and rightly so the Honorable Kerala High Court has referred the case back to the trial court to look into the matter and then come to a conclusion. Thank you very much.